All right. I think we are live here. Um, Good morning, everyone in the US, and good evening or at a time if you're watching from elsewhere. So welcome back to this week. So let's ask the first question here. Right? Did the COVID lockdown increase or worsen dementia in older adults? So if you just want to watch this much, the quick answer is yes. And you didn't have to be infected with COVID to show mental decline. So that's the overall message. Now I'm going to go over some studies on what the COVID lockdown did to older adults' mental health and the possible reasons. Now, I know some studies talk about how COVID-19 infection and long COVID impact brain physiology, but here I'm going to focus more so on how the government COVID measures impacted us, even after the infections or even without the infections, right? So, in fact, there's also a newer study saying that with more compliance with the government, there may be a lesser chance for falling sick with COVID initially, but on the other hand, the likelihood of having worse mental health outcomes increased, and we will go over that. All right, so let's look at some research here. Right, so this is early on during the pandemic. This is an review article published in the Nature Review Neurology in 2021, summarized how the pandemic posed a unique risk to people with living with Alzheimer's disease and dementia. In brief, the risk amplifies for them because they have a lower ability to take care of themselves or follow safeguard recommendations, and people with dementia also had worse conditions once infected because the population generally has a worse baseline health conditions. And most importantly, the article pointed out that social isolation as a risk factor that negatively impacted the mental well-being of this particular population. So that is pretty early on, focusing mostly people with dementia already. Now, so moving forward, more recently, here is a second article that is published in April 2023, a research article that is published in Alzheimer's Research Therapy, specifically look into how COVID-19 lockdown impacted memory decline in patients who visited Alzheimer's Center in Amsterdam 6 months to 1 week before the first Dutch COVID-19 lockdown and had a second visit 1 year later. Now, the study, the patient had a different state of mental status, so decline. Some had dementia, some have so-called mild cognitive impairment, MCI, they abbreviate as, and some had the subjective cognitive decline or SCD. Now, MCI and SCD are pre-dementia stages. Okay, so how did the lockdown impact the care system for patients with cognitive impairments? Basically, they concluded that the healthcare appointments and contact with informal support system were downgraded, impacting patient care and well-being during that time. So the research proposed that social restrictions and lockdown during the pandemic disrupted the supporting structure and potentially increased the rate of cognitive decline in patients with neurodegenerative diseases. So they compare two cohorts, one pre-lockdown, one historical cohort from 2016 and 17 for comparisons, and they look at the mental status with different testing. One is called the trail making test. Basically, it asks the patients to connecting a set of 25 thoughts as quickly as possible. Another one called mini mental state examination. Another one called the Ray auditory verbal learning test, which tests the verbal and non-verbal memory performance. So let's go to what are the key findings here. So here is a graph that I want to show you. So this graph basically, kind of tells you that those that were in pre-dementia stages, that so-called the mild cognitive impairments and subjective cognitive decline, showed a faster cognitive decline during COVID-19 lockdown based on this revolved score. And faster, however, on the other hand, they didn't see that they see faster decline in patients with dementia already. And one of the major limitations, and they mentioned in the study, is that patients with cognitive decline might not apparent in dementias because they're already low baseline cognitive functions. And the mental status declined in those with dementia may not reflective in cognitive tests, but rather more so in the behavior side of the changes. So, what is the take home message from this study here? So, lockdown and social distancing measures during COVID-19 pandemic increased the rate of cognitive decline in people that with pre-dementia stages, and disruptions of daily activity structures and reduced social interaction combined with the stress and anxiety of the disease may exacerbate the underlying neurodegenerative disease, leading to faster cognitive decline. So that was in Dutch study, and let's look at another one, more recent, that is published in November 2023 in the Lancet Health Longevity Measures Cognitive Decline in Older Adults in the UK. Right, so a lot of these studies coming from Europe actually. A lot of the European country did have a more stringent lockdown compared to the United States. Here. So this study reveals that lockdown during the COVID-19 pandemic had led to a significant decline meant in brain health among people aged 50 and over. Right? So we're not talking some of the really old population. 50, I don't think they're considered old at all. So they look into the levels of memory and cognitive functions, including decision making and problem solving, and then let's look at the graph here. The graph is really, really cool. Let me pull down a little bit. All right, so this graph, they show that cognitive decline accelerated 50% faster during pandemic, which is the green line the first year, the blue line the second year, compared to pre-pandemic period, which is the red line. Now, this is more so of all the patients from 50 to 90. So it's a large group. Okay, large group. And here is the second figure that is also quite interesting. This one points out that even older adults without a history of COVID or mild cognitive impairment show accelerated mental working memory decline, which is the light blue line. Okay, those are without history of the disease or mild cognitive impairment, and also a more faster decline in the executive function, which is the red line. All right, so from 2020 to 2021, and from 21 to 22. Now, and remember, these two lines are the peoples who are considered generally healthy. They were not infected, and they didn't have any forms of mild cognitive impairments to begin with. Now, so what are the possible contributing factor that is so significant, leading to these significant cognitive decline during pandemic lockdown? So they point out a few. They look into a few. One being lack of exercise. Being lack of exercise, and also increased alcohol consumption during the pandemic. Second is loneliness and depression made it worse. And individuals who already shown signs of mild cognitive decline before the pandemic showed an even greater rate of decline. So this message sort of support the first study. Now, of course, most of the country lifted the majority of the lockdown procedures about a year into the pandemic. That was reflective of the quickest decline, which also happened in the first year, 2020 to 2021, when the lockdown was most stringent. But however, even after some loosening of the restrictions, after that, the decline pattern continues into the second year. Remember, at that time, a lot of vaccine rolled out. A lot of people were getting that, so the government think it's okay to loosen a little bit, but the decline continues. So the impact went beyond the initial national lockdowns. Now, this study raised some concerns about the lasting impact of lockdowns and restrictions on brain health in individuals 50 and over. But however, it didn't, go a step further. So there is a decline. Does it increase the risk of dementia development? This study didn't do that. So a little bit regroup here. So we've looked at several studies, and both studies and highlighted some important facts. Number one is very obvious: lockdown lead to social isolation. You don't need a study for that. But they pointed out, and lockdown, accelerated mental decline even in 50s and above. And like I said, 50, we're not talking about very old people. And I really don't think anyone less than 70 these days are considered old. And in fact, I know many older adults physically and mentally active well into their mid to late 70s. So so those are generally healthy people. Now, when lockdowns are designed to slow down COVID-19 spread to older populations, on the other hand, accelerated mental decline in the same group of people. Remember, at the time, they were always saying if you don't get vaccinated or if you don't do so, then so you are, being termed in the media, it called like grandma killer or something. It's very bad. I mean, those terms. But so the protecting the elderly were some of the main goal of all these lockdown. But well, yes, it protected in some way. On the other hand, it also hurt them some way. Although it's not physically apparent at the time. So what does today look like? So there is a more recent study that has not been really published, very officially published yet, but it is a new research finding released by the Bangor University in Wales, also in the UK, that suggests that individuals who strictly adhere to COVID-19 lockdown rules are experiencing worse mental health outcomes today. So there is a difference here. They claim that people with communal personalities characterized as caring, sensitive, and aware of others' need adhere most rigorously to lockdown protocols. These people are more worried about catching COVID-19, and while fear increased compliance with health advice, it also negatively impacted individuals' well-being and recovery. And communal types exhibited the highest level of ongoing disturbance to their mental well-being. On the other hand, people with the so-called agentic personalities described as independent, competitive, and design control were least likely to follow lockdown measures strictly, showed better resilience in rebounding back from the effects of the lockdown. Now, of course, most, if not all, government officials at the time insisted the benefits of lockdown, even as sacrificed personal freedom and some level of economic activities. But these new findings tell a different story. The story of COVID aftermath. Now, some lives were perhaps directly saved from contracting COVID because of these measures, but at the same time, the lockdown policy and associated isolations also lead to mental decline in older adults, regardless of COVID-19 infections. They didn't have to be infected. There's also a decline because, resulted from isolations and continuous loneliness. So these, those who were in the pre-dementia state worsen a lot faster than in those dementia due to these isolations. So people who were doing okay or not so bad, you know, declined much more. Now, unfortunately, there is a poll that was conducted by the Alzheimer's Research UK reveals that 40% of UK adults were not aware that dementia is something very serious and is a cause of death, despite it being the largest killer in the UK. So, dementia is not only just the mental decline or mental or cognitive decline. So, now while COVID associated death was one of those highest killer in the past few years. Associated, I said, because different country characterize COVID death slightly different. The excess death. All right, we always talked about excess deaths. We always say excess deaths continues. There's multiple contributing factors. Maybe this could be one of those, partially due to this increased dementia rate from social isolations. These things are hard to measure, right? But what I'm saying that is a possible, perhaps it's a hypothesis at this point when we're linking at these dementias. Now, yesterday I posted a short video with new findings that social isolation was partially a modify. It's a really a modifiable risk factor. Okay, social isolations for particularly these social isolations were tied to young onset dementia. All right, so it is really important to notice that, but we can change that, right? We can change that, and the so what it tells us, these new and older studies really did a decent job in supporting the theory of this time bomb that were set by the lockdowns a couple years back. So if you haven't watched that short video, check that out. Just 1 minute of your time, doesn't take a very long time. So let's put everything together, put some thought there. Now, I know the majority of my viewers 50s and above, and I don't mean to scare you with this video, but in fact, my hope is to really bring you awareness of how important it is to spend time with friends and families and to make up for the lost time in the past few years. It not only strengthens bonds between friends and families, but also help prevent dementia and lower the risk of related death. Okay, so it's not very long this week. So that is everything that I have. Now, if you have following this channel closely for a long time, and you would have noticed that I'm introducing more wellness topics and highlighting nutrition, and physical and mental health tips and news. And I hope you can share what you learned from this channel with your friends and family, and perhaps maybe just let them know to watch from me directly if to know about this channel. All right. So that is all I want to point out today. So after watching this, get out to talk to your friend, right? Talk to your friend and talk to your family. Spend more time with them now that we are more so back to the normal time, new normal. All right. Thank you so much for watching. All right. Thank you so much for watching, everyone that tuned in there. I see a lot of the familiar names. Again, thank you. Thank you, Old School. Thank you, Jim. Thank you, Jonah. Thank you, Amber. You guys are like the Karen. You guys are always my loyalist. Okay, the most loyal viewers. You guys tune in every time live. I'm so appreciative for that. Like I said, let's make some connections, and I'll call that a week. I'll call that for today. Right. Take good care. I'll talk to you next time, or you can watch my short. Thank you very much. Yes, it would be interesting to see years after years. I hope that decline, mental decline, slows down. And like I said, these things are harder to measure and really takes a few more years to get the data. All right, thank you, James, for such thoughtful comment. All right, take good care, and I'll talk to you next time.